Florida is an interesting state in terms of prostate cancer demographics. First of all, there's a very large senior population, and clearly prostate cancer is a disease typically of the older man, so it is particularly germane to the group here. There is also a significant African American population, and that is one of the highest at-risk groups for prostate cancer. You also have the Hispanic population, which traditionally is a group that tends to avoid proactive healthcare services. So in terms of access to treatment for prostate cancer, you can almost view Florida as a test case for why access is really important. And this leads to the broader discussion about integration of healthcare services. It's all well and good to go ahead and have state-of-the-art, world-class healthcare available, but it doesn't do you any good if patients don't go ahead and get it. And that's fundamentally the concept of group practice integration. When we integrate services that are traditionally only available in brick-and-mortar hospital settings that, number one, have been documented to be the most expensive site of care. Number two, can be very difficult to get to and inconvenient for the patient. And number three, are typically a little bit more dehumanizing in terms of their approach to patients. If we could go ahead and offer the exact same standard of services and a comprehensive integrated set of services actually in the patient's own community, it is far more likely that the patient will access those services. So in that fashion, that's really the main advantage of integrating services into groups. And Florida is a tremendous example of this. There are probably more large integrated urology group practices in the state of Florida than in any other single state. So this has really been almost an incubator for this type of concept, and I think it's resulted in enhanced healthcare for Floridians.